Welcome back to Catalyst University. My name is Kevin Tokoph, and in this video, we're going to continue our discussion of best practices for strengthening external rotation of the shoulder by looking at strengthening in a more elevated position. And the two positions we're going to be looking at here are this position of 90-90 flexion and 90-90 abduction. Now, the terms 90-90 come from the fact that, number one, the elbow joint is bent to 90 degrees in both of these positions, and then also the shoulder joint is at 90 degrees, but of what? In this case, it's 90 degrees of flexion. In this case, it's 90 degrees of abduction. So 90-90 flexion, 90-90 abduction. But before we dive into any of those specific exercises, we really need to have a good framework of understanding of what is the best method by which we strengthen these muscles. And there's really two schools of thought. One is isometrically, and the other is dynamically through concentric and eccentric contractions of those muscles. So let's figure out what is the best way. Well, understand that in the vast majority of shoulder motions, whether it be a lateral raise, a bench press, an overhead press, a snatch, a clean and jerk, whatever it might be, the rotator cuff muscles in general are functioning as stabilizers. Whenever you hear the term stabilizers or stability function, think isometric. But does that mean that isometric contractions are the best way to strengthen these muscles? Well, what we know is that in terms of really any measurable muscle parameter, whether it be size, strength, power, endurance, whatever it might be, that isometric strengthening, although it can help in some circumstances, and maybe some people have to do it, maybe because of contraindications or precautions post-surgically, isometric contractions are inferior when compared to concentric and eccentric contractions in producing measurable changes in any of those aforementioned parameters. So if you're looking for particularly size and strength, your best bet is going to be to go with something concentric and eccentric. So dynamic strengthening through as much of a tolerable range of motion as possible. That's going to produce bigger gains in the muscle, whatever parameter you're looking at. Now, when it comes to isometric or stability training of the rotator cuff muscles, there's really two exercises that come to my mind, although there are countless others that you could give. These are just two common ones that you might see. The first exercise, which is shown right here, this is the wader carry. Now, the wader carry is done usually with a dumbbell or a kettlebell in the bottoms up position, and you can do it in the 90-90 flexion position, 90-90 abduction position. You can even do it in the 90-90 scaption position. All that really changes is which parts of the deltoid are most active and how much serratus anterior activity you get, et cetera, et cetera. Really doesn't change too much on the rotator cuff group itself. But in any case, when you do this exercise, it will certainly elicit activity of the rotator cuff group, including the internal rotators, which we're not covering in this video. But there's two important key pieces of information to keep in mind. Number one, we cannot confuse sensation with stimulus, okay? If you do this exercise and hold it for long enough, you will feel the rotator cuff muscles burning, on fire. They're working, there's no question about that. But it's not really giving a huge stimulus to the rotator cuff muscles themselves compared to what we're going to see later on in this video. So yeah, it'll burn those muscles a lot, but the amount of load that they're actually taking and the amount of stimulus they're receiving is not that much. It's kind of like when you're doing a deadlift, and some people will say, erroneously that is, to when you get to the very top, squeeze your glutes. You're not getting really any benefit from squeezing your glutes at the top of a deadlift. All the stimulus is coming from the bottom up to the top, not at the top. And your glutes will feel on fire if you squeeze them on top of a deadlift, but that is again confusing sensation with stimulus. And then the second thing is, if you were to load enough resistance to provide a significant stimulus to the rotator cuff muscles, another muscle is going to become limiting and you're not going to be able to lift the weight. It's going to become so massive, whether it be the wrist or the forearm muscles, the deltoid itself, something is going to give and you're not going to be able to lift the weight. So you're much better off performing an exercise dynamically through concentric and eccentric contractions of the rotator cuff muscles, particularly external rotation here, and using a significantly lower weight to give a similar stimulus. versus one that you're not even going to be able to hold up in the first place. And we can make similar arguments for this second exercise. I'm not sure of the exact name of this, but it's essentially an overhead press where the bands, or you could also use cables, are trying to pull your arms forward into some combination of extension or internal rotation. Again, the rotator cuff muscles here are functioning isometrically, but the limiting factor here is going to be, let's say, strength of the lower traps, or strength of the posterior deltoid, or strength of the middle deltoid, and other muscles that are holding you in this position, especially as you get the arms up towards the top. So you theoretically want the limiting factor to be the rotator cuff muscles, and that's not the case in either of these two exercises, assuming you want enough stimulus. So to get that stimulus, as I've been saying, we need to go to dynamic resisted exercises, and that's where we're going to start right now, particularly in the 90-90 flexion position. Now, there's not a lot of exercises in this position, and quite frankly, I think this is the least important of the two positions, so we're good there. Strengthening external rotation at 90-90 flexion is actually quite simple. All you need is a band or a dumbbell. I'm going to start with the banded version of this exercise, which you see right here. We, of course, want the arms supported where the shoulder is at 90 degrees of flexion, and then you're just working external rotation against the band resistance through as much of a range of motion as is tolerable. Now, when you perform this with a band, the peak resistance is at the top of the movement. And then we have the dumbbell version of this same exercise. Now, unlike a band, which is subject to stretch, and the more you stretch it, the more tension you get, the dumbbell is not subject to stretch. It's just a fixed static object that you hold. So now the highest resistance is at the bottom of this movement, which also corresponds to where gravity has the biggest effect on the arm. It also corresponds to the point where you have the biggest stretch on the external rotators of the shoulder. So if I had to pick one of these two exercises for the vast majority of people, including myself, it's going to be the dumbbell version. However, if you have issues with lockout, or you're working on that end range mobility and strength, then the band version is going to be the best version for you. So you kind of just have to see which one fits your needs the best, or that of your patient and client. Now, one question you might have is why do we do this with the arm supported? Couldn't we make this more difficult by having the arm unsupported? And the answer to that is yes. We would make the exercise more difficult, but we would be doing so not by adding resistance, but by introducing a stability requirement on the movement. When we introduce that stability requirement, there's a little bit less force output through the muscles, and we're not going to get as good of strength gains. So your best bet for strength gains is to support the arm, take away that stability requirement, and then just focusing on hammering out that movement against resistance with a tolerable progressive overload approach over time. So that was external rotation strengthening at 90-90 flexion. Fairly simple. We're now going to move on to the same thing in 90-90 abduction. And we're going to start off with two exercises that are almost identical, just different positions. We'll start with the band version of this exercise. So as we talked about before, the peak resistance here is at the top of the movement. So if you're having trouble with lockout, working on that end range mobility and strength, whatever it might be, you're probably going to use the band version. However, if you're just looking for straight strengthening throughout the whole range of movement, the dumbbell is going to be the better option, because once again, it places the point of peak tension on the muscle at the bottom of the movement, which also corresponds to max stretch of the muscle and where gravity has the most effect on the forearm and the hand. So dumbbell is going to be the better option for most people. But again, lockout position, if that's your issue, end range mobility, definitely hit up the band version of the exercise. We're now going to move on and talk about some other exercises that don't isolate external rotation like the other four did, but they certainly require external rotation and the use of other muscles that we've seen in other videos, like the posterior deltoid, the middle and lower traps, etc., etc. The first of these is the face pull row. Now, there's a lot of ways to do face pull rows. You can use a rope attachment at the gym. You can use bands, as I'm showing right here in the video. But any way you do this, there's one really important cue that I always tell people. You're essentially aiming for your temples. So if you're using a band, like I am in this video, you start with an overhand grip, thumbs pointing inwards, and you essentially row your thumbs to your temples. Okay? That is the simplest way for most people who have never done this to grasp a face pull row. If you're using the rope attachment, you at least aim in the vicinity of your temples. But if you are using bands for this, and you can hold with an overhand grip, point your thumbs inward, pull your thumbs to your temples, that is a face pull row. Now, strictly speaking, for the external rotators of the rotator cuff group, the face pull row is not optimum because we don't have a very large external rotation moment at the shoulder. So what we can do is a little modification of this exercise and turn it into what we call a head pull row. Now, the term head pull row you won't find anywhere on the internet because it's something that I've created as a little modification of the face pull row. And essentially what you're doing is, as you can see here, holding an overhand grip, same thing as before, but instead of dissociating the thumbs, you keep the thumbs together and just pull right to the top of the head, thus the name head pull row. And you can also see it has a much bigger external rotation moment at the shoulder, thus requiring a much greater activity of the infraspinatus and teres minor. So if you're going after more lower traps, some scapular muscles, posterior deltoid, face pull row is going to be better because it doesn't require as much of that external rotation moment of the shoulder. Therefore, you can load more weight. If you're going more after strict external rotators, like teres minor, infraspinatus, the head pull row is going to be the better option. Just know you're not going to be able to lift as much weight. If we want to challenge the infraspinatus and teres minor even more, we're going to further modify the head pull row into what we call the field goal row, which you see right here. It's essentially starting in that same position, overhand grip, and then you're going to move the arms into a position of 90-90 abduction, which is a field goal post in American football. If you're really wanting to work on challenging that end range 90-90 abduction position, particularly for external rotation, which is really important in the end stages of, let's say, a rotator cuff repair or just conservative rehab of a tear, this is going to be a really, really good exercise, and I've had a lot of luck with it. Very good, but it's very challenging. If you look at this picture right here from left to right, we've got the face pull row, the head pull row, and the field goal row. And as you go from left to right, we're getting an increase in that external rotation moment at the shoulder, an increased challenge on the teres minor and infraspinatus, the external rotators, and you're going to be able to use less weight as you go towards the right on this. With a field goal row, this is a very challenging exercise. If you're using bands, start low. Make sure you've got good tolerance for it. If you're using a cable machine setup where you can take the pin out and put on a different weight, start with the lowest weight on the machine. Whatever resistance you're doing on the face pull row, you're at least going to take it down 75-80% for the field goal row. It's that difficult. But if you do this exercise, you will reap the benefits and have better strength in that position and better stability. Because remember, when it comes to stability, what's providing the stability? The muscle. And the stability it can provide is proportional to the strength that it has. Okay? So work on that exercise and your shoulders are going to be really good. Now let's say you've got no gym membership, no gym access for whatever reason, so you don't have a cable machine. You got no bands. All you got at home are a couple of dumbbells. What can you do? Well, you could do what are called Balboa flies, which are shown right here. Now, the Balboa fly is comparable to the field goal row with one big difference, and that is the trajectory of the arms. In a field goal row, we start out with the arms in front of us and go into the 90-90 abduction position. In a Balboa fly, you are sitting and you're leaned forward a little bit and you stay leaned forward and your arms really just start by your sides. So there's a lot more of a shoulder flexion moment that's required. So there's going to be a little bit of anterior deltoid towards the top. There's going to be a lot more posterior deltoid, but you're still going into that same 90-90 abduction position. Now, why do you lean forward? Well, if you sit upright and do it, you lose all the tension at the top. So just by leaning forward like that, now my external rotators feel a lot more tension. They don't feel any right here, but they feel a lot more in this position. So you want to make sure that you stay leaned forward the whole time. Now with any of these exercises, if any of them elicit shoulder pain, back off. Maybe consider using less resistance. maybe consider using a smaller range of motion, maybe consider choosing a different exercise. And if that doesn't fix the problem, you should really go see your local physical therapist and get your shoulder checked out. But if you're an unrestricted lifter, you don't have any issues, these are some really good exercises to focus on. Remember that we want the shoulders to have stability, but what provides stability? The muscles. And a muscle is only going to be able to provide as much stability as it has strength. And the best way to strengthen a muscle is through a dynamic resisted range of motion, concentric and eccentric contractions of those muscles. So hopefully this video gave you a really good understanding about how to best strengthen external rotation of the shoulder in the 90-90 flexion and 90-90 abduction positions. Please make sure to like this video, subscribe to my channel, and hit that notification button for notifications for all videos in the future. Thank you so much.